Oh, hello. Welcome to Clear Vision Eye Clinic. How are you doing today? I'm great as well. Thank you so much for asking. And what can I do for you? Alright, so you want to become a new patient here? Yes, absolutely, we can do that for you. First of all, welcome. My name is Alex. I am the optometrist here, and I'm also filling in as the receptionist today. It's very nice to meet you. And you're here today for just a basic annual checkup, right, for your eyes? Absolutely, no problem. Now, because you are a new patient, I would like to ask you a series of questions, just some basic information and your medical history. Would that be okay with you? Great, let's get right into it. It should take around like 2-3 minutes, not gonna take too long. I can get you out of here in 20-30 minutes. Great, let's get right into it then. Now, can I get your first name and last name? And how do you spell that? Perfect. And your date of birth? Perfect. And your address? Zip code? Perfect. Your phone number? Great. And your email address if you have one? Yes. And your medical history. Do you have any allergies I should be aware of? No allergies? Any history of eye disease? No? What about family history of eye disease? Do you know or don't know? Not sure? That's okay. Okay. And for today, do you have any sort of eye pain currently? No? What about sensitivity to light? No? Any blurry, fuzzy vision? No? Okay. Good. And any eye floaters, like a black spot following your vision when you look around? Like a small one? Perfectly normal. I get those too. And on an average, how many hours a day do you spend in front of a television, computer, laptop, sort of thing? Like 5 to 7 hours? Okay. I'm just gonna send this in real quick. Do you mind telling me your previous eye doctor? Like where they're located? The address if you know? You don't? That's okay. I can just find it on the system. Here it is. The reason I'm asking is because I'm sure they have a more detailed report on your medical history and your history on your eyes and everything, and I would like to have those information in case you want to come back next time. And don't worry about any of the insurance problem. This is free of charge because you are a new patient, so we don't need any of that, okay? And if you enjoy your experience, you can always come back and become a regular patient here. Okay, so I send the request already, and once they respond, I would have that information. I just want to have your consent for that. Good. Thank you. Perfect. Alright, so because this is your first time here, I would like to do a more detailed eye examination on you. Would that be okay with you? Good. First of all, I want to ask if you are able to do the pupil dilation today, or not very good time. Not a good time? Oh, you drove here today? Yeah, that's perfectly fine, no problem at all. But the reason I want to do that is because I want to look behind your eyes in the retina to make sure that there's no problem there, there's no retinal detachment and whatnot. But that's okay. We can definitely reschedule if you enjoy your experience here today. No problem at all. So what I usually like to do for my new patients is to kind of go over like basic eye anatomy with you just a little bit, so you have a more clear understanding of your eyes. Would you be interested in that? Great, let's get right into it, okay? I have all of the paper and everything ready to go. So I have a very nice picture here of your eye. Obviously it's not that big, it is not drawn to scale, but it's more zoomed in so you can see better. Okay, so let's get into it. Alright, so like I said earlier, the reason I want to dilate your pupil is to see in the back of the eye, and the retina is right over here at the end, in the back of the eye. Now, retinal detachment can be quite normal for most people. Obviously, you're more prone to it when you are getting older, and when you don't take care of the retinal detachment, it can cause serious eye damage, permanent eye damage as well, like blurry vision, and it could cause blindness. I'm not trying to scare you, but that could happen. So we can definitely reschedule when you're more convenient to do the pupil dilation, because it can make your pupil dilated for at least an hour or so, and when your pupil is dilated you can't see clearly. It gets very blurry vision, like you're not wearing glasses if you have really heavy, reliant on that. So yeah, let's get right into it, okay? So the outside is where we're gonna start. Do you see the white part? Yes, all around the eyeball. This part is called the sclera, and the sclera is this white layer that maintains the eye shape and also can prevent your eyes from taking serious damage, so it acts as like a barrier right around the eye. And you can see how the eye is not perfectly sphere, and that is because of this part. And we'll go layer by layer. It's very simple. Now the first layer is called the cornea, which is outside over here. The cornea is a clear transparent layer, and the reason they're clear and transparent is to allow light to travel through the eye. Now the second layer right here is called the anterior chamber. It's just a layer of watery fluids. But behind it is something you're probably very familiar with, and that is the pupil and the iris. Now the iris is around the pupil, and it just controls the eye diameter, or the pupil diameter. So, like I said, the pupil can dilate or constrict, and when it dilates, it's when your eyes try to take in more light. So for example, you're in a dark room, you want to take in more light to see clearly, your eye would dilate, your pupil would dilate to see more clearly. That's why it takes a little bit of time for you to adjust in a dark room before you can see like very faint shadow of items in the room. Now, for example, when you're outside in a sunny day, your pupil will tend to constrict to prevent light from traveling in. Well, less light, because you don't want to damage your eye. That's why it is not recommended for people to stare directly at the sun. It can cause serious eye damage. And then, let's see, behind that we have what we call the lens. It's behind the iris and the pupil. And this part has a process called refraction, which is kind of just help you focus and change the focal distance of your eyes to help you see more clearly. That's why when you're looking at an object further away, everything else looks more blurry, but when you look at the object you're looking at, it's more sharper, kind of like how a camera works, And then the conjunctiva, just the layer of, to keep your eyes lubricated and moisturized. So I think I went through most of the things in here. Do you have any questions? Great. Do you understand what I'm talking about? I try to be less scientific about it, just more basic about it. Alright, let's get into it. So if you don't mind, I'll give you a little option. Would you prefer me using this pen, the flashlight, or would you prefer me to use the flashlight? Both? Yeah, why not? I'll use the flashlight first. Now I want you to just stare directly at my nose, okay? And I'm just gonna point the flashlight in your eye. Just keep looking at my nose right here. Do not follow the light. Okay. Good. If you don't mind, I'll come a little closer. Okay. Good. Okay, for the next part, I'm gonna use this pen, and you're gonna follow the pen, okay? With the light. So just follow the pen. Very, very good. Good. Okay, I'm turn off the light and keep following it, both eyes. Good. Now, can you cover one of the eyes? Just keep following it. Now, cover the other eye. Good. Now, stare directly at this pen and then don't move your eye. Just keep looking straight ahead and tell me when you don't see the pen in your vision anymore. There. Good. Try again this way. Once again, stare directly here. Do not look away and tell me when. Here. Good. And let's repeat that one more time. Here. Good. And one last time. There we go. Good. So I don't see any problem with your eye movement. Perfect, actually. And any problems during that test? Any pain, sensitivity to the light? Good. Perfect. You're doing great. Alright. Now, before we get to the chart, I want to test your whether or not you have color blindness. And this is very simple. You just be looking at these pictures real quick, and then you have to tell me what number you see. Now, if you don't have color blindness, this should be really easy, like 1, 2, 3. Okay. Now there are 6 different numbers in each of the circle, and I would like you to identify all of them, okay? Alright, you ready? Let's begin. Right over here. 7, good. This one. 13, very good. This one right over here. 16, very good. Alright, this one. 8, very good. And then this one. 12, very good. And then this one. Perfect, 9. And you don't have a history of color blindness, right? Good. Perfect. Now, are you ready for the next part? The famous part of the eye examination. Everybody knows this one is the Snellen chart. Now, I would say try your best to read the letters, because I want to have an accurate measurement of how bad your eyes are, how good they are, you know. Can go both ways. So I'm going to point at the line and you can just repeat the line, okay? And I will tell you if you're right or wrong, and I'll tell you to try it again. Yeah, no problem at all. Are you ready to begin? Great. Alright, so please look at this chart real quick, okay? we're going to start from the top. This one is A. Very good. That's the first stage. Now we're going to move on to the second one. S. M. Perfect. And then we're going to move on to the third line. R. I. S. Perfect. And then we're going to move on to the fourth line. Can you see perfectly okay? Good. T. H. E. B. Very good. Now stage number 5 down here. As you can see, there are more letters now, right? A little bit harder to see. Okay, it's perfectly normal. It's supposed to be harder. Let's start with this letter. E. S. T. I. F. Y. Perfect. I'm gonna switch sides. My hands are getting a little tired. Can you see fine? Good. Now we're gonna move on to the next line right here. O. U. S. E. E. T. H. Perfect. The next line you might have a little trouble seeing. You have to be like 20/20 vision to see the next one, which is fine if you don't have that. Let's just go through it, okay? I. S. Y. O. U. Try again. Good. A. R. Try again. E. A. Perfect. So, you have very good vision. Are you wearing contact lenses? You are? Okay, then they're very up to date. The prescription is good. Or your eyes didn't get worse since the last time you got your prescription, right? Same? Good. Alright. Oh, did you want to try the last line? Absolutely, we can definitely do that. I like a challenge, and I like that you're challenging yourself. When I do these eye exams, I always ask my patient to be, try harder, because you don't want your prescription to be too high, because, that would drag your prescription to go higher if it's not accurate. And if it's too high, sometimes you can get a little lightheaded because it's just not the right fit for you. So I always say try your best. It's better to go lower a little bit than go too high. And since you're challenging it, let's do it one more time, okay? We're gonna do the last line on the bottom here. Ready? M. A. C. I. N. G. Very good. No, there's no numbers in here. It's an H. Yeah, no, can trick you a little bit, right? It looks like a 4 without this leg over here. This one. A. H. Try again. A. Very good. And this one. It's not a 4. It's an H. Very good. Looks like the H gave you a little trouble, right? So you passed all of the tests very, very well. Congratulations. Let me just update this test result into our system. Right. And you told me you're wearing contact lenses, right? Okay, no problem. Do you want me to go over the process here with you? Yeah, we do prescription glasses as well as contact lenses. We order from suppliers. We can just get that delivered to your house as well. Yes, I can definitely do that for you. Do you want to make an appointment for next time? Oh, absolutely. We can do the eye examination for getting your prescription for contact lenses, as well as doing the pupil dilation to see your retina to make sure there's no problem in the back. Yeah, absolutely. Which day is more convenient for you? A weekday, like Wednesday? Yeah, absolutely. I would assume around the same time. 1 p.m. Is that okay? In 2 weeks. Yes. 1 p.m. in 2 weeks on Wednesday. Alright, you are all set for that. And I put you down for contact lenses fitting, as well as the pupil dilation to check the retina. The whole process should take you 20 minutes, but the pupil dilation might take you longer because the eye drop will take around 10-15 minutes to take effect, so you will have to sit here blinded for a couple of minutes. I guess it shouldn't take too long, but the contact lenses fitting should only take 10 minutes to make sure that the brand we give you fits perfectly, because the size does matter on the eye, because if it's too small, it doesn't fit your cornea, the lens or anything cornea very well, it can bug you when you blink, which I had a lot of problem with back then. Now it's perfect. I'll actually show you what I'm using. I'm using the AlexAuAsmr with Hydrolux. This is the one I use. And there is one just AlexAuAsmr. I think it's another name, but that one I tried and it was it's a little bit too dry for my taste, and for my taste, right? But for my eyes, when I blink, I can feel it move, and it's extremely irritating. And unfortunately, I got 1 month supply of it, so I had to use that up before I get new ones. And then I discovered that they have this one, the Hydrolux. That one is more hydrating to your eyes, and it feels like it's not even there. I'm wearing it right now. It's wonderful. Now, I bought this one, I think it's the 90-day. So this one doesn't cost that much, but I got 2 boxes because, you have 2 eyes. So my left eye is a little bit higher prescription than the right eye. So depending on how our exam goes, you might have 2 different boxes, or you might have 2 in the same one. But don't worry, the degree would be labeled on each of the packaging for you to know exactly what you're putting in your eyes. And I can also give you the prescription for you to order online if you like and whatnot. I have 2 boxes, and for example, I'll show you this one. This is for my left eye. It is, as you can see, 8.5. I'm kind of blind, 8.5 on this one, and this is for my left eye. And then the right eye is actually just a little bit smaller, is 8.0. Yeah, so this is 8.0, and they come in this case. These are daily, so I just rip it out, put it in my eye, call it a day after that, and take it out. Yeah, so they come in like this. Do you have any questions so far? I personally prefer the daily one because the monthly one can be kind of dangerous if you don't keep it clean, because every time you touch something there's bacteria, and then you put it in your eye, and then your eye can get infected. But with the daily one, you can just throw it away after you're done. More clean, but it is a little bit more expensive, but it's definitely safer personally. It's my personal opinion. Obviously, if you're very clean, very diligent, monthly would not be a problem. I used to wear the monthly one, but like if let's say there's like a little tear on it, you cannot wear that anymore because it can damage your eye. So it is cheaper, but at a cost. And obviously this is more expensive, also at a cost. You get what you pay for. So you had a good time today? Yes, it's very important for me to have good customer service, and also for your safety. And I'm very glad that you enjoy your time here. And I'm already having you back in 2 weeks. Don't forget, it's on Wednesday actually, at 1 p.m. in 2 weeks. Yeah, I can send you a notification. I have all your information, and the day before that, I'll send it to you. And if you want to cancel, just let me know. I'll be here every day. Well, it's been a pleasure. Thank you very much for coming in, and I hope to see you very soon. Thank you. Goodbye.